In today's video, we're going to be having a look at heart failure and specifically the diagnosis part of heart failure. So the very first thing that I want to mention is that heart failure in itself is not a disease. Rather, it is a state during which the heart is unable to have its cardiac output meet the metabolic needs of the body. So keep this in mind as we go through the diagnosis of it. So in order to aid the entire process of understanding what we should do step by step in order to diagnose a patient with heart failure, we're going to be looking at a specific patient. So let's say our patient is a 48-year-old male who comes into the clinic because of paroxysmal nocturnal dyspnea, palpitations, fatigue, and also dyspnea even at rest. So these are the symptoms that he presents with. Now, throughout the history, you also find out that he was diagnosed with hypertension 2 years ago. He also has diabetes and has a history of myopathy in his family. So based on all of this, we can now notice that he actually kind of has signs that are quite related to left-sided heart failure. However, we're not sure of this. So we're going to need to do a little bit more investigation in order to prove it, basically. So far what we have is we have a suspected heart failure. Why? Well, because of the symptoms and the signs that he was presenting with, but also the risk factors that was also presented during the history. So what's the very first thing that we want to do? Firstly, we would like to take an EKG. So why an EKG? This one is not going to be diagnosing it. The main reason why we would need an EKG is mainly because a normal EKG in somebody who has heart failure is pretty much improbable. So most likely there will be some kind of abnormality, and this will not help you completely diagnose it. However, it will maybe help you also to find the etiology or something like that related to the heart. So back to our patient. Say, for example, our patient has pathological Q waves. So what this means is he has basically a history of an old myocardial infarction that occurred a while ago. So we can see that this wouldn't be a sign of his heart failure, but it could be possibly the reason why he is experiencing heart failure. So now let's move on to the second thing that we would like to do, and that is to measure the levels of natriuretic peptides. So there's two that we would like to be measuring, that is BNP and the N-terminal proBNP, which is basically the inactive form of this hormone. The reason why those two are important are because these two hormones are released when the heart is undergoing ventricular remodeling, because these hormones help the heart basically and have an anti-fibrotic and anti-apoptotic effect. So these will be released in higher amounts than normal when there is ventricular remodeling. So these you can see up here are the two values which would help you diagnose the patient with heart failure. And now say, for example, these are the values that our patient ends up having. So you can see these are quite elevated. So these are really strong indication that there is first cardiac remodeling and a high probable chance of heart failure. But now the next thing that we want to do is decide. So we're going to go off that our patient has elevated levels, right? So this would be a yes, elevated. However, obviously some patients might not. So let's keep going with our patient and go with yes. So what's the next thing we should do? We should go for the echocardiogram. This, you can basically consider this one like the gold standard. So the echocardiogram will be really helpful for many things. First thing is, well, it gives you an image of the heart. So you'll be able to see the way it looks. So if there's any dilations, hypertrophy, if there's any valvular issues, if there's wall motility issues, all of this will help you both find a possible etiology, but also be able for you also to measure some things. For example, the left ventricular ejection fraction. Why is that helpful? We'll see a little bit later on that, but this will be really helpful both for treatment and just what are we going to do once this person has been diagnosed. So say, for example, for our patient, we end up seeing this. What is that? Well, we can see that the left ventricle is quite dilated. All right, so this is what we're observing with this patient. Now, say, for example, the echocardiogram was normal. What would happen then? Well, it's pretty much like having the natriuretic peptides not increased. This is pretty much unlikely. It's very unlikely that you have heart failure. But now with our case, we have an abnormal echocardiogram. So we move on to the next part, which is, like I said before, measuring the ejection fraction. Sorry, here that should be over 50%. Okay, but so why is this one important? Well, it will classify the type of heart failure and for treatment. So now say, for example, our patient specifically has under 40% ejection fraction. So this is reduced. So what would this do? This pretty much gives our patient his symptoms. That's basically what's happening. So overall, that's all we needed to do. So congratulations, we finally diagnosed our patient with heart failure, specifically reduced ejection fraction, heart failure. So as a quick recap as to what happened, well, overall we can see that his main history was the old myocardial infarction. This could have caused some myocardial death, causing some scarring, weakening of the ventricle, and therefore the ventricle then dilated, wasn't able to contract as well, and this basically allowed then for the cardiac output to be reduced, causing all of those symptoms. So that's overall what happened. Thank you.